Dr. Joyce, thank you so much for coming here today. For our audience, can you please give us your name and a brief description of what you do?
Sure. So, hi everyone. I'm Dr. Joyce Varughese. I am a gynecologic oncologist, which means that I take care of women who have cancers or precancers or possible cancers of any of the female reproductive organs. So ovaries, cervix, and uterus are the most common.
Now, are you working for a health system or are you working independently?
So currently I'm the medical director of gynecologic oncology at Capital Health in Pennington, New Jersey.
Wow, that's really good. As far as your ethnicity is concerned, how would you like to describe yourself?
So it really depends on the audience that is asking me that question. So I consider myself Indian American, and I always have. But obviously, if I'm in a group of people who are Indian, then I consider myself Malayali American. But I mean, usually the default that I go to is Indian American.
So how comfortable are you with the language itself? Like you said, Malayali American. What's your level as far as Malayalam is concerned? Do you read, write, or?
So with Malayalam, I can read it. I can write it if I really was forced to, and I can conversationally speak it. So when my husband and I go to India, we can get by. We don't need our parents there to help us. But do I consider myself fully fluent in it? Absolutely not. But conversationally, yeah, I can understand it and we can speak it if I needed to.
So when you say going back to India, so where in India, where does from a parental standpoint, are you familiar with their ancestral roots? Where exactly in Kerala are they from?
Sure.
You know?
So I'm very familiar with their ancestral roots because I've gone back quite a few times and stayed there on my own for months at a time too. But my dad's family is from a small town called Naadan, which is near Korancheri. More people have heard of that. It's all in Pathanamthitta district. And then my mom's family is from Koni, also in the Pathanamthitta district in Kerala.
What's your fondest memories of that place?
Oh, I have a lot of fond memories of Kerala. Probably, honestly, one of my fondest memories is probably one of my more recent ones now. We just went to India this past Christmas with our kids, and that was our daughter's first time going, our son's second time going. And we were at my dad's old village and near our old ancestral land that we've since sold. And a neighborhood kid, well, he's not a kid, a neighborhood guy was riding his motorcycle, but I had known him since we were kids, and we would go there and play, and we'd play with his sisters and stuff. And he stopped, and he said, and he recognized me, and he said, "Joyce." And then we were talking, and one of the things that he said to my kids was, he's like, "We used to love when your mom and her family would come visit because they would always bring us school supplies and backpacks and pencils and erasers." And he was naming specific things that we had brought them, which I honestly didn't even remember until he brought it up. But it was a really great learning, a really great lesson for my kids too, who are who always want the newest this, or why don't we have 10 pairs of sneakers or this or that? And I was like, did you hear what he was really grateful for? He was grateful that we brought him pencils and erasers. So it was really nice that he remembered, 30 something years later, that he still remembered that our family would do that. And honestly, I mean, I can't take any credit for it. It was my parents who were, who knew what the people needed, and I would bring that.
So you said something about experience. Do you believe that kind of experience that you had in Kerala, right, is helpful in our current scenario, in your current situation when you're raising your own children, when you're dealing with the public and things like that? Is that is that an important influence?
Oh, absolutely. Because I think that you could choose to live in a bubble here, in terms of your kind of suburban life and but realizing that that people have very different experiences out there, and that this is not how how the majority of the world lives. And for me, especially as a physician, I take care of a lot of patients who right now from the Trenton area who are really poor and just have very different lived experiences. I just had a patient recently. This is fresh in my mind because it's just to show how different experience, how you're exposed to so many people that you just don't even know what they're going through. But she was super excited because her granddaughter had just turned 18. And I was like, that's so wonderful, congratulations. She's like, yeah, she's like, she graduated high school and she didn't have a baby. And I was like, I didn't realize that like, you know, like that's
That
like a
would be
huge,
so
that, like
huge,
that's like such a
yeah.
huge accomplishment for their family that like their granddaughter graduated and isn't like a teenage single mom, right?
Right.
And
Something
so,
that we wouldn't consider
Right.
as a, you know, a criteria. They're
Right.
considering as
Yeah.
a minimum requirement. Like, oh,
Yeah.
we're successful or we attained that.
Absolutely.
So
and so,
let me-
go ahead.
oh, sorry, go ahead.
No, I was going to say, so the same thing, like going to Kerala, like where you see people who, when we were growing up, there were houses near us that didn't have electricity, didn't have running water, right? And so, but we were like kids and we would all just play together, and it was like a really simple life. It was kind of, you know, when you ask me about memories, like some of my fondest memories, like honestly, my other fond memories are playing with the like neighborhood kids and going on really long walks with my uppachan, like just, you know, kind of meeting everybody around. Half the people were related to us somehow, but, you know, like kind of, it was just, you know, just those sort of like getting to know
Funny
the
you say that
neighborhood.
because that's exactly my best memories too. It's the simplicity of the lifestyle because not everyone didn't have everything, but you just made do with what it. So let's talk about a little about your growth here in the U.S. Okay, how was it? Like you talked about a bubble, right? What's different about your growth here? Was it a bubble or was it a combination or like how did you feel about that?
So I grew up in Staten Island, so that's part of New York City technically. So it's, but it's a bit more suburban than what people really think about New York. But given that, it was pretty diverse in terms of like race, socioeconomic status, those sort of things in terms of the schools that I went to. But then for high school, I went into school into Manhattan. And so that was kind of pretty eye-opening. That really exposed me to kids who were, you know, wealthy kids from the Upper East Side and Upper West Side, and also kids from the Bronx who, you know, like grew up in the project. So that was, like, so when you asked, did I live in like this little bubble? Like, not really, because partly just because of the schools that I went to and the neighborhoods that I was, you know, kind of going into. But then so that was during like Monday to Friday, right? But then like Saturdays and Sundays, our social lives really revolved around the Malayali community. So like Malayali Association or a church and, you know, and you know, things associated with that.
So let's step into the Manhattan scene here because you're moving from one very diverse, both economic and ethnic background, and you're moving into this very, you know, privileged environment. What do you think were some of the difficulties that you faced? I mean, as far as like, was it racism or was it the social economic scenario? Like, did you face any of those kind of difficulties, and if you did, you know, how did you handle that?
I honestly, like the first time, and probably like one of the only times that I felt that I remember experiencing racism growing up was actually in Staten Island on the bus. I think I was like a 4th or 5th grader, and a kid told me called me a Gandhi and told me to go back to my country. So like it was in Staten Island, not in Manhattan, not like, you know, and not really since then. And so I'm sure that my parents experienced it more than I did, like, but I don't
So
really
for
think.
personally, you didn't, I mean, there weren't that many of those kind of situations that you had to face, but it was a lot. Do you believe that it was a lot easier for you? I mean, as far as integration is concerned?
I think it was probably a product of where I was growing up, that it wasn't, I mean, while it was still a white majority, but there were a lot of other people of other ethnic backgrounds too. So it wasn't like I was the only non-white person there. Does that make sense? Yeah.
Yeah, sure. So what do you think is different between when you were growing up versus what your children today are going through?
Oh, so many things have changed, I think. I think one, I think like we as parents are much more lenient than our parents ever were, you know, and I think part of that was that they didn't really know a lot about, you know, American culture, or maybe what they knew was only the bad stuff, like, you know, the kind of the concerning things, and they like were kind of trying to shelter us from that and shield us from that. But like even like little simple things, like I can count on like one hand the number of times I went to the movies with my parents. And even if I wanted to go to the movies when I was a little bit older, it was always with church friends. Like I don't think I ever went to the movies that my parents knew about with my school friends. Like when I was in Manhattan, then I could go and they wouldn't really know, but it was like, but they never, but it's not like I ever asked them to be like, hey, like, my friend so-and-so wants to go to the movie, like, go see a movie, can we go? Like, unless it was a church friend, we never really went. But like, and even, so it was like simple things like that, I don't know, like, we never had sleepovers, right? Like, pure, like, and play dates, like, what the heck is that? Like, who's got time for all that? Like a play date. Like in some ways, I think like I kind of understand why my parents were like, yeah, you don't need a play date. Like we're gonna go over to your cousin's house. Like there's your play date, or like your friends from church are coming over. Like there's your play date, right? Like sort of thing. So, so I think that like now it's like there's this like I don't know push towards like all these activities and like being busy and stuff and don't get me wrong, like we participated in activities. I participated in sports when I was in high school and stuff. But I just feel like we actually had weekends like kind of together, and for the most part, my family my mom worked nights as a nurse, so other than the nights when she was working, like we were all sitting together, we prayed, and then we had dinner together as a family. If it was, I have one sister, so whether it was all four of us or if my mom was working, it was three of us, right? So, I think that that's kind of lost because there's just so-and-so's got karate now, and this one's got a piano lesson, and I think that that's been taken away a lot. And my kids are young still, so I can't even imagine like when they get older.
So like, from what you're saying, so like the style of parenting has changed, is what you're basically saying. Well, our question towards you is more geared towards like from a personal experience, you as this young Indian girl, right? Growing up in Staten Island, all right? If you were to place, say, your daughter, all right, or your son in that same situation in today's scenario, do you believe that there will be a difference in what they face?
Well, I think they're exposed to a lot more just with social media and what their friends to tell that, like, I think there's just a lot more exposure to those sort of things, to a wide variety of things, but but I also think in some ways, because we didn't have cell phones, we were more independent, right? Like I can distinctly remember being 9, 10 years old, leaving our house, going biking with our friends in the neighborhood and like disappearing for 2 hours and then coming back. My parents had no idea where, they kind of had general idea of where we were in the vicinity, but like there was no way for them to just like find us, right? And I think that teaches you like responsibility and kind of teaches you how to like manage conflict and all of those things, and also builds trust, right? Like that, like you knew that your parents trusted you to be able to do that, right? Like now everybody's got cell phones, like, hey, where are you? Where, like, it's kind of like, I think that like in some ways, like do kids know that their parents trust them? Do their parents trust them? I don't know. Like again, my kids are young enough that they don't have cell phones, so I don't have to like deal with that part of it, right? Like, but so that's one thing. So then when you're like, dropping, if my daughter was to be dropped in like, in the situation that I was in growing up, I think that like, I don't know, like I think like my parents gave us a fair amount of independence. So I think that was, but a fair amount of independence to a limit, right? Like they were very particular about who they would let us like kind of hang out with, right? Obviously they couldn't control that at school, but on evenings or weekends, evenings we weren't doing anything, like we were at home, like there wasn't, like weekday evenings we weren't going anywhere, right? So, but on weekends a lot of stuff was based around family or church, and so it wasn't like there was time to do that. And so I can tell you that my daughter, even now, she's like, you never let me hang out with so-and-so from school. And I'm like, because you see her 5 days a week. Like you don't need to see her on the weekend, kind of thing.
I just went through a similar situation.
Yeah. And so I'm like, the weekend is for family time. Like I don't get to see you that as much during the week. So like, yeah.
That's a key point though. So my question to you, like you growing up when you were young, did you, like, I believe that we automatically, our age group, or, we automatically assume that the weekend was for the family, or was Sunday was for the church, or we knew some kind of social event was going to take place on a Saturday evening. Right? Do you believe that the next generation, the children that are coming on board now, I don't think they are on the same boat or
I think that's sort of how, like, what you prioritize. Like my kids know Sunday mornings we're going to church, right? Like even this morning, right? My daughter was like, I don't want to go to church. I was like, well, got to get up and go. Like I was like, you don't really have a choice there in that matter, in that matter right now. And of course, then when we had to leave, she didn't want to leave because her friends are all there. So it's kind of, when my son played, when it was his soccer season, he knew that if he had soccer games on Sunday mornings, he wasn't going to be playing in those games. And his coach knew that too. So I think it's like what you prioritize and like, and then your kids see that that's where your priority is, right? So, sure, if you prioritize like hanging out and socializing and those sort of things, well, then that's what your kids are going to prioritize. If you prioritize, family time and, quality time and doing things together or going to church, like, whatever you might prioritize, then that's what they're going to prioritize. So,
so if you were to give advice to a young couple that's coming up, they're South Asian of origin, I know they're coming up, they're both professionals. You mentioned prioritization, right, which is critical. What would your statement to them be? What would your advice be to them as far as managing expectations as a South Asian, with the cultural concept, and being American and being that professional? What do you think are the three? Like, I'm assuming you have some correct criteria or some. What would you advise?
I would tell them it's really hard. It really is. Like, because I think back and I'm like, well, okay, the weekends weren't that busy for us because our parents' social lives, for the most part at least, revolved around church stuff. And so that was like, whereas here now we have, between my husband and I, we have friends from high school, we have friends from college, we have friends from the churches we grew up in, we have our church family now, we have cousins all around, like, and we have our work friends who we actually like to hang out with, sort of thing, which we didn't have all those competing interests, I think, growing, like our parents didn't have all those competing interests growing up. So do I have...
it's a lot easier for them to make a choice to say they go this way.
Yeah, and like, especially when you have 2 days of a weekend, right? Or like, count Friday night, maybe 3 days, like to kind of spend that time. But I think that, one, forget about, before you even get to being a couple, I think like finding a partner that has similar priorities and values as you, I think is really important, because I think if you've got competing priorities and values, that's going to make things a lot harder as you're growing together as a couple, and then if you're going to raise a family and those sort of things. So, I mean, I think that's, I tell this to my medical students and residents all the time. I was like, one of the most important things you can do is find the right partner in life, because just in terms of like what we do for work is not easy, and it's you really need to have somebody who's understanding to and that's not unique to necessarily, I mean, I think medical training is probably unique in that sense, but just every job has its like, ups and downs and pros and cons and, difficult days and stuff, and you kind of want somebody who's going to understand that and like be there and supportive for you.
Do you believe that there is a value in retaining your cultural background in the current century? I mean, you mentioned there's a lot of influence. Children nowadays are influenced. My daughter's influenced by, Korean pop or whatever it is, The next generation is going to be influenced by something else. How do you, first question is, do you believe that there is a purpose, there is a value associated with retaining your culture? And if there is, how do you go about it?
I think there is a value in knowing your history. And I think that when we forget our history or where we came from, that's where, your values and priorities shift. And so I don't think that's unique to Indian Americans either. I think that, like, if you look at previous immigrants that came over, like Italian Americans, they really had a very strong, robust community in their first and second generations here, and then it kind of falters out, right? Like the first and second generation speak Italian, like would speak Italian, so like now they don't, right? Like, and so, we're sort of, we could look to those communities to sort of see like where we might be headed as Indian Americans, Malayali Americans, right? But I think that, I can speak to like my own family. Like my parents didn't come from like really well-off families. They came from small villages and towns, and I think that really humbles you to remember that like, you can drive a fancy car, live in a big house, like have money to spare and go on nice vacations, but not for nothing. Like somebody worked really hard to get you to that point, and of course, your own hard work kind of plays into it, but never forget like sort of the people who came before you. And I'm a big believer that like the prayers of the people who came before you also, and the prayers of those who passed on, I think are still like really important in our lives. So
I mean, no doubt. But how do we like? So I mean, it's this. This is a thought process. We understand there is a value associated. There's absolutely a value associated, but we can't force it upon a generation. So
you can't force it upon a generation, but let's be honest. Like, when you look at me, you know that I'm not a white American born in, like, whose family was like, is from Mississippi, 10 like kind of thing, right? So, they can, people can pretend to deny that or want to deny that identity, but in America, especially in this day and age, right? Like, we are still in some ways seen as the other, right? Like, and so as much progress as we've made in trying not to, like, I think that, I don't necessarily think, like I definitely feel that being American is a huge part of my identity, absolutely. Especially when you leave America and you go elsewhere, like, that's a huge part of my identity, right? But I think that you'd be kidding yourself if you think that you're only American, right? Like, so I'll give you an example, right? So my daughter, she was probably like 5 or 6 years old, and one day she comes home from school and she's like, "Mommy, I'm white." And I didn't even know where this came from. And I said, "Okay, Layla." I was like, "Why did you say that?" She's like, "Well, so-and-so's white and so-and-so's black in my class, and I don't look like, this kid who she said was black." And she's like, "So I'm white." And I'm like, "Well, why?" Like, and so in her mind, white was the default, right? And I said to her, I was like, "Well, actually, you're brown." I was like, "And you're Indian," right? And but like, I mean, that was, I think she was like 4 or 5 years old, like, when she came and said that to me. And so it was like, I didn't really understand where it was coming from, but like, even at that age, to her, like, the default being in America was that if she's not black, oh, well, she's white, right?
Exactly.
Kind of thing. So that's where I'm like,
there's an in-between color that needs to be
there, and so that's also where I was like, "Oh, girl, we got to teach you who you are," I gotta like, mommy's not been, daddy have not been doing a very good job of that, but. Yeah, so that's where I'm like, well, I think that there's definite value in knowing and remembering your identity and your history and your culture, but also knowing that, like, it's important to assimilate, and and we're not all, there's a ton of mixed race couples and mixed race children, and like, but I think it's really, I mean, I have a bunch of friends who've married outside the Indian culture, but like their kids, probably more so than mine, love dressing up in Indian clothes and, like, learning about their culture and that part of the culture.
Once again, it goes back to the prioritization.
Yeah, exactly.
So if you give an emphasis on this particular topic, I'm sure the next generation will pick up on that emphasis.
Right.
Basically,
if you deny it, then, like, well, of course your kids are not going to claim that they're Indian, because like, why would they if their mom was denying it?
So let's go on to your career, right? And what we're trying to find out is, how did you get from point A to point B? Okay. All right. So you mentioned that you're both an oncologist and a board-certified OBGYN. Am I correct on that?
So I'm a board-certified gynecologic oncologist.
Okay.
So you go through OBGYN and then do subspecialty training. Yeah.
So let's start with the most obvious quiz. What made you decide to become a doctor?
So going back to being Indian or Malayali American, right? So that was a path that was probably not pushed on, but like strongly encouraged by my parents. So I actually when I was little, I used to say I was going to be a part-time doctor and a part-time lawyer. And then my parents said I would be in school forever. So then I decided not to do that. But part of me still wishes as my husband can attest to, I still think that I have that lawyer part in me. But part of it also I just grew up around healthcare, right? My mom was a nurse, my dad was a dialysis tech, and became a dialysis facility manager. So, and then my sister went to pharmacy school. So that was just sort of what I grew up around and knew, and I happened to be really good at my science classes, and much more so than in any of my humanities classes. And I just enjoyed that part of it, like that stuff more. So that was also very helpful, that I enjoyed all that. So I kind of pretty much knew when I was kind of graduating high school that I probably wanted to become a physician. Partly also because I had shadowed physicians prior to that, and sort of seen like the variety of things that were available in medicine. And so when I was in college, I actually did not do a science major because I knew that I would be doing science for the rest of my life. So I was actually a Sanskrit and Indian studies major. So I could kind of like deal with the humanities side of me that like.
Wait. Let's respect. So your college major was in Indian studies and Sanskrit.
Yep.
And then you became a physician. How? So what was the honest on that? Like,
So, in order to go to medical school, you just have to take your MCATs and do your pre-med classes. So I could do my pre-med classes as my electives.
Okay.
But my degree is actually in Sanskrit and Indian studies.
Do you think that was very important to you? I mean, like, you made this conscious decision to become a physician without taking a lot of science classes, but like, what was the decision behind the choice of this particular major? Like, and what was the significance of that?
Part of it was that I just thought it was a unique thing to be able to study from like an academic standpoint, in terms of Indian studies, but I still had to take my biochem and physics and stuff, and like statistics and whatever else, I don't even remember now, for my pre-med classes. So I just didn't want my entire schedule to be all biology classes or all chemistry classes, because I knew that I would be dealing with that the rest of my life.
So at no point, so what if, say for instance, after the end of that 4 years, you decide, was there ever a thought that you wanted to continue down this academic from the language standpoint?
Not really. I think that, like, in hindsight, I was like, oh, maybe I should have been a linguistics major. I think it just opened up my eyes to a lot of other potential possibilities of things I could have studied in college. But no, because while I thought it was interesting and, like, did I want to make a career out of that? Not really. Like, was I going to do
But you have to admit, it is a kind of unique, process. Because if you talk to most children, everyone says I'm in pre-med. I mean, they're in a science subject or they're science focused before they go into med school. Right. Here you are in a very liberal arts, academia, and very complicated, academia scenario. And then you decide to go, let me do my MCATs and,
Well, but remember, I graduating from high school, I kind of knew that I was going to go to med school. So that was I purposely planned my schedule knowing, all right, I'm going to take my MCATs, I don't remember when I took them, junior year. I don't remember when you take them, that I was going to take them, so that wasn't a question.
So at what point did you decide on your specialization? Because, so the reason why I'm asking is there's a couple types of doctors, in any profession, you have individuals who go to med school and just become, just a day-to-day regular doctor, family medicine, general medicine. Then you have people like you who go on to specialize into these very, very minute, very specific areas. So what was the decision behind that to this?
So as I had mentioned earlier, that I kind of grew up in a medical family, and my dad worked in dialysis. So I thought I was going to go to med school, become a doctor, and maybe become a nephrologist, a doctor who deals with kidneys, just because that's what I was surrounded by, right? That's what I kind of knew growing up. And then I went to med school, and I was like, I really realized that I really liked doing surgery and doing procedural-based stuff. So then I kind of shifted focus a little bit, and then I thought maybe I'll become a general surgeon or a vascular surgeon. And then I did my OB-GYN rotation, and I loved the women's health aspect of it.
Got it.
Around that time, somebody close to us had a miscarriage, and so it was sort of just combined a lot of stuff that I was there's all this women's health, you could do there's so much opportunity within global health for women's health. So that's what led me down the path of OB-GYN. So I went into an OB-GYN residency thinking I was going to become an OB-GYN, maybe get my master's in public health and save the world. And then during my OB-GYN residency, that's where I was exposed to gynecologic oncology. And that's there's a few subspecialties within OB-GYN. So people have heard of high-risk OB, and there's gynecologic oncology, there's reproductive endocrinology and infertility, so fertility docs. There's something called urogynecology. So there's a few other more now since. And so that was really my main exposure to gynecologic oncology, and I loved it because it combined really complex surgeries. You got to know patients and their families, and you got to follow them through a really difficult time in their lives. And you share their successes, and you got to celebrate with them when they were done with all their cancer treatments, and you got to unfortunately cry with families and the patients when you had bad news to give them. So
was that so it seems to me there's a very empathetical side of yours, and there's a social perspective. You mentioned these two things with the relationship. Was that an important factor towards your decision-making process?
Yeah, I think that, people, at least when I was growing up, I think that's finally changed, and people realize they're oh, go into medicine, and you'll make a lot of money. it is not the field to go into if you want to make a lot of money. Like, go into business, go into like tech, like just like the amount of money you spend and the years of your life and family events that you miss and those things do not make the eventual salary worth it, right? And so if you're here to make money, right? It's just it's not so I think that. If you don't go into it with everybody's like, oh, I want to help people, right? Like, it's like, why do you want to go into medicine? Like, I used to interview people for like med schools and be like, I want to help people. I'm like, okay, so like, how do you think medicine is going to help you do that, right? Like, so and that's where the specific different specialties, you can do that in various ways, right? And like, I think that if you don't have that altruistic kind of motive behind why you go into medicine, you're going to be pretty miserable. Because, I mean, training's pretty hard, like, like even after you're done with training, like it's a great profession, but like, there are really hard days that you can have. And so yeah.
So for a new person coming on board in your current role right now, what would you say is what's the minimum requirements to maintain what you do today? Like from a professional and a personal level, like, discipline-wise?
So from a professional standpoint, like career standpoint, to like maintain things, right? Like there's still articles to read every couple of months, like quote unquote tests that you have to take, and and all of that, and then you have to maintain your skills, and so you have to be clinically active and those sort of things. But that's because I'm an active clinician, right? There are a lot of physicians who don't practice clinical medicine now and do other things, right?
Research only.
But then and there are clinicians like me who also do like have some research piece of it and things like that. But then from a personal standpoint, I don't know if I'm answering your question. I hope I am. Now that my kids are a little bit older, it's important for me and my husband to like take care of ourselves a little bit. So I try to go to the gym like 3 to 4 times a week, but that means that we have to coordinate who's going when. So if somebody's home with the kids or feeding them dinner or transporting them to whatever activity they might have and those sort of things. But so like, I mean, I think more than, yes, discipline's important, but I think more than that, it's just like planning, like being good about planning things out, because there's like long-term things that you have to plan out and short-term things that you have to plan out. And then also, again, just having a support system, I think is just super important.
So that's exactly the correct, that's what we wanted to hear, because in any profession to be successful, it's not just a successful at a single instance. You want to be successful continuously. And you mentioned it, so you're talking about not only education, you're constantly re-educating yourself, is what you're saying. 2, you're looking after your health now, because you're getting older. You want to make sure that you're always available at work, that you're standing, you're working like that. And then last but not least, you're also talking about a good support mechanism. Can you elaborate a little bit on that support mechanism and how important it is for you from a career standpoint?
Yeah, so from a career standpoint, I don't think that anybody gets to where, anyway, I couldn't even graduate OB/GYN residency without having a good support system. My co-residents are still some of my closest friends. But beyond that, like my mentors who trained me, I'm forever indebted to them, And so, and I think that, even actually when I was thinking about going into GYN oncology, I was like kind of having this like, oh, do I really want to do that? Or like, it's more years of training. It's like, whatever. And like, I had this one doc that he and I were going for surgery together. And I was like, Dr. Lima, I was like, what do you think about me going to GYN oncology? He's like, you would be great at it. He's like, it's a really tough road, but he's like, here, and he's like, I actually thought, and he was like, I thought about going into it, but I didn't for this reason, like kind of and sort of, and he's like, but these are the reasons I wanted to go into it. And like, he's like, so it was a matter of, it was really helpful to hear that from him. And similarly, after fellowship becoming, going into getting my first job out of training and all of that, like you really like rely on your mentors to kind of help guide you. One of the things that I tell my trainees, like my med students or residents, is I always tell them, like, don't, for lack of a better word, just don't piss people off. Because especially like, the field of medicine is small. The field of OB/GYN is even smaller. The field of gyn-onc is smaller. But like, what I tell them is I was like, look, you may never want to go into OB/GYN or care about women's health or any of that. I was like, but you don't know that my, best friend from med school is, the cardiac anesthesiologist that you want to get into their program, right? Like you have no idea about those sort of things, right? Like so,
the community is basically what you're saying. It is a very tight-knit community.
It really is. Like, and it's a small, and like, I think as we get older that I even realize that the whole world is like really much smaller than you think it is. But just kind of knowing that you're not going to advance just by yourself. Like, you know what I mean? Like that, rely on the experience of others who've gone before you and rely on like, their good and their bad experiences, right? Like find people who will help like tell you about their successes and their failures and have like, there was a period of time where I was really burnt out actually in clinical medicine and I thought about leaving clinical medicine. And I talked to a really good friend of mine who knows me very well and he was like, we talked and like he actually is a physician but is not practicing full-time clinical medicine and we were talking. He's like, Joyce, he's like, you don't want to leave medicine. Like after the end of the conversation, he was like, he was very kind. He was like, plus it would be a loss for us, but he's like, but you really don't want to. And then I hung up with him and I was like, yeah, he's right. I really don't want to. I was like, I just need to find another job, kind of thing. So like having people who are honest with you and not going to just like say what they think you want to hear, but like are going to be like, no, like this is not the right thing for you to do, or this like, I know you and this is like, you're making a big mistake kind of thing. So.
I want to talk a little bit about the education portion once again, okay? So we can all agree from a career standpoint, there's a lot of workload, there's things that you need to maintain. So you took a different approach in terms of your education and how you got to this particular point. What's your opinion about today's education? Like, because it's a very important topic for, especially amongst the South Asian community. A question is college meant for everyone? What is your opinion of this? Is trade school an option or is college meant for everyone? Let's start with that very basic question.
I think that's a bit, you have to take that question into the cost of college education now is ridiculous. And so I think that if you have a specific profession in mind and the only way to go to become that profession is to go to college, well then you're stuck, right? Like that's what you're gonna have to do, right? But if there are, if you're entrepreneurial, right? And you have like a great business idea and have really good business sense, like is that, personally, I think college is not just about the education. I think it's also about growth experience, the people that you meet, and all. But with the cost of college education these days, I think it's really hard if somebody knows that they're really good at, I don't know, like a really good building something, right? Like could they go and become like a contractor or an architect or those sort of things, and like build a business out of it potentially? Like I can't speak to it because I've never done it and I don't know. But I think that the college piece of it it's not just for the education part of it. I think that the other value that came to me, at least from going to college, was the friends that I made, the connections that I made, and like the growth experience of being away from home, living or like figuring things out, being independent. I went to college before cell phones were common. I got my first cell phone a month after I graduated college. So like, that was, I had definitely had a very different experience than kids these days are going to have. But that's,
So, I mean, you mentioned financial support. It's very important. Like today, education, it's, what's an Ivy school right now, even if you're in-state, it's around 65 or 70.
Yeah, I mean, like it's close to like $80,000 a year for a private four-year college, right? And so now, say you even get like $20,000 cut off of that, right? Like you're looking at almost $240,000 for a four-year education. For what, right? Like, so are you going to graduate with an English major and work for a publishing company that make $60,000 a year? Is that $240,000 loan or however, or $200,000 loan or $150,000 loan? Like, and I don't know the answer to that. Like, I think like people have to place a value on that. And so, I talk about this I have, when you're talking about like support system and stuff, I have colleagues who have kids that are older, in college or about to go into college or about to graduate, and we have these conversations. Literally, like I operate with a general surgeon, and I talk about this because his kids are older. He's about a decade older than me, and so like we chat about this because I think it's really important to like learn from other people's life experiences and stuff. And so, his daughter wants to live in New York City, and he's like, that's great. How are you going to pay for that? You're, like the job that you were planning to go back to grad school. He's like, I think that was a better idea, kind of thing. So it's just.
But we are in a culture in our community, especially the South Asian community. There's a heavy emphasis on college education. There's a heavy emphasis on science or STEM-related professions and jobs and whatnot. Like I remember when I was young, business school was considered, not a deal. Now it's different, right? There's a value in MBA and everything. But the question here is like, so if a young South Asian child, right? Decides like you're correct. You have to make a choice. You have to think it through. Like, is this the path I want to take? They make a choice and say, all right, this is not the path I want to take. How do we communicate that? Like, if your children came to me, well, how would you prefer them to communicate this?
So I've said this to them because one time I forgot what profession they said. I was like, you can do what you want, but you should be the best at what you want to be, best at that, right? Because then you'll be what are we setting our kids up for? What's our long-term goal, right? Our long-term goal, at least for me, is to raise independent, kind, responsible kids, adults, right? Yeah. Who can support themselves. Right, and so if they can do that, great. But I do tell them, I'm like, well, if you're going to go into XYZ profession, you're not necessarily going to live the lifestyle that we're giving you right now, right? That's also a real, they've got to be realistic about that. Yeah. But I don't necessarily think. I think that that's changing quite a bit in terms of the STEM field and that sort of thing. Because at least for us growing up, it was medicine, engineering, or law. In law, where did law get thrown into that? that was, but was an okay field to go into, right? But I think that now, especially seeing a lot of successful South Asian actors and actresses and authors and there's so many. I think that there's a lot of other fields that people are realizing that you can be successful at. And like I said, I was be the best at,
I think what you're saying basically is that you make that choice, but at the same time also open up to make sure they understand that there is a realistic expectation of a certain amount of suffering that needs to be undergone. Or, like you mentioned, even in the medical profession, you spend hours and days away from family and everything. Are you prepared to take on that particular, subject matter or whatnot? Right. So this career part, I want to end with this very important question to you. Let's talk about legacy. Mm-hmm. Okay. How do you what is in your eyesight, in your opinion right now? How do you see your legacy ending up, from a career standpoint?
Oh, from a career standpoint, I think that.
How would you like it to be? Let's put it that way.
What I'd like it to be is that the folks that I've trained end up being excellent doctors and excellent physicians and take wonderful care of their patients. But then also just knowing, for me, it's enough to know that I've supported and been with women and their families through a difficult time in their lives, and I actually keep a box in my office. I still have it. I've had it since 2013 when I graduated fellowship, and any cards that patients give me, I keep in there for if it's a hard day, I'll look at it and I'll be like, oh yeah, there are patients who appreciated what I did, kind of thing. But I think that that's easy to lose sight of. That oh wow, I kind of really did that change people.
Connection.
Yeah,
you're in a field. Yeah. With a very direct contact, you can be in business and not have any relationship with the consumer.
I literally talk to at least 40 to 50 women, patients, every week that and chat, about, and tell some of them very good news, tell some of them very bad news, it's, and just chat and I learn about their families. I know what vacations are going on. Because the field that I'm in, I see patients almost every 3 to 4 months, in continuity. And so it's I kind of become part of their families. I literally know their partners and children and hear about their grandchildren or the births of their grandchildren or their daughter's getting married or it's so I think in terms of my legacy from a career standpoint, I'd if like one person can remember that, hey, Dr. Varghese made a difference in my life, like I'm, thrilled and, about that. But I think my greater legacy will hopefully be my children that, and like I said, my hope and prayer for them is that they just grow up to be like kind, responsible people who don't burden others.
If you were to describe yourself as a vehicle, okay, it could be a truck, it could be a bus, it could be a car, a bike, what would you choose?
Probably a bicycle, because it's environmentally conscious. It is like dependable. It's like, what's the word I'm looking for? Like adaptable, right? Like you can change the tires on it. Like, like if you're going to go mountain biking, but I think like the environmentally conscious part of it, like, you don't rely on, you don't need to rely on anybody else. You don't need to rely on gas. You don't need to rely on, you just rely on yourself.
Oh, see, that's the key thing. I love that.
Yourself, right?
So the reason why I'm asking you is that it's a great pathway to figure out an individual's personality.
Yeah.
So in this particular instance, you're talking about independence, right?
Yeah.
You're talking about flexibility, right?
That was the word. I was like adaptable. I was like, what's the word I'm looking for? Yeah.
Right.
Yeah.
Third, you're talking about you don't care about what other people are thinking. That's another thing. There's no flamboyance in this way. It's also a question of practicality. So you see those three key elements in her choice. So because we were all.
That's exactly me. I'm very practical.
Here we go. Do we have that on clip? Because I want this. This is exactly because on the side note, we were choosing I chose my choice when I made that choice when I was 22. I had a long time ago a friend of mine asked me that question. My choice was the Escalade. To me that was my card. He chose an Ambassador, and that was kind of unique. It was it's not technically perfect, but it's a bulldog. Right. It will go through anything. It would it never crumbles. That type of. So that kind of described his personality. Him is still thinking through. It's been 3 days. He's still thinking trying to figure out what it is. But I think that's an excellent answer.
All right, Jeff. I don't know how to ask it, but I'm still gonna shoot. Since you got married, that part of guy brings in the bread. How do you handle that? How do you handle that?
You find somebody who's not so insecure to care about that sort of stuff. I think that that's a big piece of it. I will tell you that trying to when I was quote unquote dating people, right? Trying to meet people, right? As soon as I found out I graduated from Harvard or that I was a physician, it was oh. I'm like, that's who I am. I can't change that. Yeah, it's intimidation, right? And so now I've come, my big thing is that I am not intimidating, you are insecure. Because all I haven't said, what I've said, I am, I'm not embarrassed by any of those things, nor should I be, right? And so I'm if you can't handle that, well, then that's your problem, not mine, so.
What were your grades like to get into Harvard?
They were pretty good. So my high school was weird in that we didn't have a valedictorian or salutatorian. I went to this nerdy high school. So, but I had pretty decent grades, but I also did a lot of extracurriculars and stuff. And so I think that probably also helped a bit. I had and not only doing the extracurricular, but I had leadership roles in those, right? So there's no formula to getting into Harvard.
So
there's a huge lawsuit right now about admissions into Harvard, so who knows?
So how easy were your MCATs though, in terms of preparation wise?
Oh, they were not easy. I studied for a whole summer.
Oh, okay.
I was in the best shape of my life that summer. I stayed at home, my parents in Staten Island. I went to the gym 6 days a week and I studied. I literally would bring stuff on the elliptical with me studying, but yeah. But I had mom cooking for me, so I didn't have to worry about that.
So you got to be careful when you say, about grades, because the assumption is, they don't need grades,
Yeah,
but there is an aspect of your education where you literally spend 24/7 with the book and reading and, what do you call it, feeding that, component.
Again, I think that science, those classes were a little bit easier for me.
Correct.
And so maybe that's why I went into medicine, right? Because then I didn't have
There's
to
a natural
study as
inclination towards it, right?
it was a little bit easier for me than I mean, college was hard because I like chose a humanities major and I had to write a lot of papers, and I'm like not that great at writing papers, right? Like, you know, give me like a problem set to do, or like, you know, like a science test. That's much easier for me than like sitting down and like writing an essay, right?
So the last piece that we want to touch base on, and this is excellent information. Thank you so much once again. But we want to also tackle some systemic issues that are currently within the South Asian community, within the American community, and in your unique position, we also want to address it from a woman's or young female perspective too. You know, some of the issues, like, you know, like we just wanted your opinion or viewpoints on, like, okay, do you think are some of the biggest health issues that are impacting our community right now, on, you know, the society right now, from a young woman's perspective?
Right. Well, so from a young woman's perspective, there's so we know that, like, you know, depression, anxiety, those have increased. We think a lot due to social media influence, but then also, even again, you know, I'm partial to women's health, right? Because that's what I do. And I think that, especially among the South Asian community, that like it's just something that's not talked about. And like there's like a whole stigma around periods, for example, which are like a totally normal, you know,
even
physiologic
today.
thing. Yeah, oh, absolutely. Yeah, I mean, absolutely. Because I think like young girls and women still suffer with like really painful, you know, monthly cycles when they really don't have to, because nobody thinks that they could go to a gynecologist, because they just think of the gynecologist as somebody who, when they're ready to get pregnant, or that's for older women, or, you know, whereas like, so like these teenagers suffer, miss school and things like that, where there could actually be really easy fixes for it. So
do you believe, I mean, the current channels, do you think there's adequate amount of that kind of reinforcement out there, that kind of information going out there saying that, look, you know, you can go to a gynecologist way ahead of time instead of just thinking about pregnancy? Or
I think the pediatricians are getting a lot better about like sort of directing, but I think there's still this like stigma amongst, like, you know, so, you know, me and my friends are like only one subset of the South Asian community here, right? Like we were born and raised here,
Correct.
But there's still a large population of South Asians and Malayalis, specifically here, who were still immigrants from Kerala, right? And so, or from outside of America,
Sure.
And so still have this like kind of stigma associated with it, and or you know, and just don't talk about it. And sort of.
So what do you think is the best way to handle it? I mean, like it's out there. You say that it's out
So
there.
I wish I had an answer for you. I will give you an example. I was trying to do a research project on HPV, which is human papillomavirus. It causes the vast majority of cervical cancers. There's a vaccine for it. And I was trying to do a project on the knowledge of the vaccine among South Asians and South Asian American young adults in the U.S. Okay? Like, how are you identified? If you identify as South Asian and not South Asian American, whatever, right? And at one institution, we got easy approval for it through the like review board in order to, you know, do research. But then we couldn't find any South Asian organizations locally that would allow us to like distribute the survey, because they felt it was like, you know, it was because there was this connotation about sex or this, and we were like, no, we're just talking about the vaccine and HPV. Like, we're not, like, there's no question, like, you know, it was just about information. Then at another institution that I went to, we had, there actually was a large South Asian population, a large population of South Asian physicians and OB-GYNs who were willing to distribute the surveys to their patients. But then the review board, because it was a Catholic hospital, were concerned about what, like, that, I don't know what they were concerned about. So we couldn't get approval from for the research. So it's sort of like, so when I say, like, you know, it's actually like, if you look, there's like almost nothing about, like, you can find stuff about Black women and Hispanic women and white women, but like the Asian American population, like specifically the South Asian American population for certain things, like there's just not enough research, and especially around women's health issues, because we're just not allowed to talk about it. So it doesn't exist. Like, and women's health in general, like, for, you know, not specific to South Asians, but like is, you know, there's a lot to be said, especially
it's a tricky area,
especially in this day and age in this country.
Even in this day, let's put it this way,
as our rights are being stripped. So.
Correct, and I agree with you that the normal routes are still closed.
Right.
But I do believe, and you have to tell me otherwise, like, I do believe that, considering with the advent of the internet, considering with communication, I think there is an opportunity for us to expand a little bit more information
There
out
is,
there?
but the problem with the internet is that there's a lot of bad info out there
Correct.
too. And young women, like young girls especially, like, I'm thinking of like 12, 13, 14, like, middle school and high school kids, like they don't know how to, like their brains aren't developed enough to understand what's good info and what's bad info,
Correct.
right? Like forget about like, even like, 7-year-old people are like sending around WhatsApp, not like nonsense on WhatsApp that they find on the internet, right? Like, so, how do you expect like middle school and high schoolers to like be able to parse out what's good information, what's bad information, right? Like what's real news, what's fake news, what's, like what's evidence-based, what's not. They're not, it's hard enough for, for a physician to be able to be like, is this a good paper? Like, is this like, is like, right, like, is this because there's a lot of stuff published, but I'm like, we're taught to think critically and be like, is this actually a good paper? Because just because it's published doesn't necessarily mean that it's like
Is it peer
actually
reviewed, or is it,
even like a peer-reviewed article, like we'll like, as part of your med school and like residency training, you learn to like really pick apart articles and be like, was this really a great article? Like, or could the research have been, like, could the data have been more robust? Like, what are the, you learn how to like construct, like criticize the articles and also, learn what's good about them because they're not all that great necessarily.
So what you're saying is that, I mean, the normal routes or the traditional routes, even though that they are closed, are still, are you saying the best way to dispense of that information? Because, I mean...
I think the best way would be for people to have an open mind and to have like South Asian organizations invite a women's health speaker and be like, here, let's talk about women's health.
That's my point, though. That's my point. Like, exactly.
And like, and talk about stuff, right?
Because you're correct. So because our next question here is like the influence of, social media in the behavior and growth. You made a very clear point. Not all the information out there is either relevant or accurate, right? Yeah. So how do you, what kind of advice do you give that generation that's coming up, as far as, parsing the information and like, picking out like, what's good versus what's bad?
Well, one, I think, right, like there's all this about like likes and influencers and all this, right? Like, sure. But like, so I think one is that as adults and parents and like mentors, right, to be like, look, we should be their influencers. Like we should be the influencers who they look up to, not the random stranger on Instagram or TikTok or whatever like people are watching these days, right? Like kind of who, and that the number of likes that somebody gets is not what makes them valuable as a person, right? Because I think there's like so much...
Today's wishful thinking.
Right,
but
I think there's so much superficiality to all of that.
Yeah.
And like, kids don't realize that there are bots that are increasing the number of likes. Like, they don't know all of that, right? And they're like, how come nobody liked my video? And like, and again, their brains aren't fully developed to really understand this stuff, right? And so, I mean, like, do I have an answer for any of this? No. But I think that it's a big problem.
I think you did give an answer because, like, once again, it goes back to the prioritization that you mentioned, right? And also a matter of communication. Like, what you said is correct. It depends upon the alternative information, where it's coming from, and, who's giving that. Like, so if you're consistently, in their ear saying that some of this is fake, this makes no sense whatsoever. Yeah. You know what I mean? Like, at some point they're gonna remember, right? Like,
and I mean, like, I'm always the mean mommy who like doesn't give my kids screen time. Like, we're pretty strict about screen time because I want to be around when they're watching what they're watching. Because you can't, like, I mean, again, my kids are younger, like 8 and 10, so they're not like, but there's a lot of stuff out there that are not meant, like, that are, like, advertises like for kids or whatever, and like really not appropriate for their age group, right? So it's just sort of, I think it's only made our jobs harder, as adults and as parents. Right?
You mentioned the meme mom concept. How important do you think that it is?
Listen, and this is not going to be popular among a lot of people. Like, I tell my kids, I'm your mom, like I'm your mommy, because that's what I want them to call me. I'm your mommy, not your friend, right? That being said, I want them to know that they can trust me and that I love them and they can come to me for anything. But like, my job is not to please them all the time. My job is not to entertain them all the time, right? Like, so I'm going to do things that they are not necessarily going to like taking away like hiding their little phone that I gave them for music and then not being able to find it. That I can't find now. So, it is what it is, right? Like, so, but, and part of that is I blame my parents because they didn't let us watch TV from Sunday to Thursday. They were really strict about things. And now, like, this many years later, I can be like, well, maybe they were right about certain things. Like back then they were wrong about everything, but maybe they were right about a few things here or there, right? So, I don't think they completely screwed up, so hopefully I don't.
So let's go into a very critical question because you're leading into an excellent question here, like the balancing act here, okay? And I'm implying for all professional young children, young adults that are coming up, but especially considering the scope of your career, right? And your environment. How do you first of all, how do you balance it? Two, if a young couple was coming up, what kind of advice would you give them in terms of like balancing all these requirements together?
Yeah, again, like I think that there's this like, it's this lie that we're fed that like you're gonna have this work-life balance. Like, you know what, some days or some weeks it's gonna be a little bit work heavy and then other weeks it's gonna be more personal life heavy, and that's okay, right? So as long as you know what you value and what you and that you are content with how that is, right? And so there are, and it's not, I don't think that's unique necessarily to being a woman or to being a physician, because my husband will have weeks where he's dealing with a project at work and he's like, I'm going to be on a call from like 6 to 11 p.m. And I'm like, okay, I will do dinner and bedtime. It is what it is, right? So I think that the nice thing about medicine and about my career now, which I couldn't say years ago when I was in training, but at least I can say now, is that I have the flexibility of being able to take time off when I need to and like kind of set my schedule. And that's, not everybody has that luxury.
Position, though,
right, not everybody has that luxury.
You did mention that in the beginning it was difficult.
Yeah, like during training, you have zero control over your schedule,
residency.
Right? Yeah, during residency and fellowship. So, it's not, but again, I think like having a support system, around to help you with that. I have no doubt that like part of the reason I passed my board exams when I had 2 young kids at home was because of my husband, my mom, and my mother-in-law.
Wasn't it recently you posted and I'm going to refer to, Robin here. You posted a picture of her, you guys enjoying the night out after she passed the board.
Oh, yeah, we had that big burger. Yeah. But you didn't see Joey was there with us, but he was like our son was like 6 months.
I do remember that.
Yeah.
You had this big.
But that was the culmination of what
you did look tired.
School too, residency. That was like the culmination of like 11 years of training post college.
Let me ask you this very critical question now. There's a lot of answers to a lot of situations and issues on paths that are generally taken by other people, right? But in today's age, our children, we're currently advocating for them to, be different. All right, it's okay to, choose a path that nobody else likes, or what do you think are the critical things necessary to lead that independence or lead that path less taken concept?
I think having a goal in mind, right? Like, because there's nothing wrong with taking a path less traveled, right? But if you don't know what the end goal is, well, then how do you know that you've gone down that you're still on the right path? Like, that you haven't veered off completely.
You shouldn't be goalless, is what you said.
Yeah,
you have to have some kind of form of it.
Yeah, absolutely. And so, and like also, we were talking about being practical. Like, I'm also very practical. It's like, so how are you paying for it, right? Because unfortunately, money makes the world go around, right? And so, and I'll give a personal example. Long before gap years were a thing, after college, I was like, I'd gotten into med school, but I said to my dad, I was like, Dad, I'm thinking about taking a year off. Like, let me defer my med school admission. I was like, thinking about taking a year off and like traveling through Europe, like traveling the world. And he's like, and my dad was like, that's wonderful. He's like, who's paying for that? And I was like, oh. Good point, right? Like, so he did not discourage me from doing that. He was like, look, great. I know that you're going to go to med school. Like, you can defer your admission for a year. That's fine. He's like, you're not you're rent free and you're not mooching off of us any longer, kind of thing. So, so it is like, sort of like, you kind of have to be very practical about these kind of things. Right? Sort of like, and maybe if I'd been willing to waitress and live in a hostel and all that stuff. I'm like, I probably could have made it work, but I didn't have a real plan in mind. I was just like, this is kind of what I want to do. Like, but that's what I'm saying, like having a goal and then sort of knowing how practically you're going to reach that goal is really important, I think. And so, again, like I think paths less traveled are wonderful, and I think they actually can, make you find something that you otherwise wouldn't have like really realized, that like a really great skill that you have, or and the other thing is also realizing that like what you are really passionate about doesn't always have to be your career, right? Like you can have a career or job that like pays the bills and is very practical, but you can still do other things that you're passionate about, right?
So I would like to end this interview with we talked about a lot of things today, What do you, in your personal opinion here, what do you think are the most critical issues that our children have to be facing right now?
Our children are facing. So I think a big thing is, and I mentioned this a few times, is really the influence of social media that and as much as you try to minimize their exposure to it, they will see it behind your back at school or somewhere, right? Making sure that their friends, and this isn't something unique to this generation, I think it's an important thing that you know who their friends are and that their friends are like share similar values as them, right? And so I think this is where it's really helpful to have older mentors also, or older the Big Brother, Big Sister programs, like those kind of just having people they can look up to or ask questions to, because they may not feel comfortable talking to their parents about certain things.
That's a good question, because when for my generation, I can attest to, when we were growing up, we had older brothers or cousins or young uncles, individuals that we always tagged along with, I do believe this generation doesn't have that. Do you think that there is a opportunity for these young adults or to actually step in a little bit more or be more influential?
There is, I think so. There is, but I think part of it, I don't know, like I feel like, so when we were growing up, like there were just, and I'm speaking specifically like kind of sort of to the church part of it, like to the South Asian, like the Malayali like community part of it. It was like our Sunday school teachers were like people that were like a little bit older than us. Like they were like the cool teenagers or like, college kids, and like we could kind of look up to them and talk to them and be like, okay, like they're still coming to church, and we're like, we can talk with them, and they like kind of are going through similar things or like, whatever. Whereas I think that's kind of missing nowadays. And I think part of it is that this is also, because it's a generation growing up on screens, that there's a lot less like knowledge of how to interact with people, like on a person-to-person basis, right? And I see it in my own kids. Like I'm like, make eye contact with when you're speaking to somebody, right? Like just like simple things like that, right? Exactly. And so instead they'd rather like text, which is totally fine, but that might put off somebody who's in their, 50s or, and willing to be a mentor, but like, you're kind of like, we didn't grow up texting. Like, that's kind of like for some people, they'd consider that almost like a rude.
Flexibility is lacking?
I don't necessarily think it's like lacking, but I think that like, there's some benefit to saying, just picking up a phone and calling somebody or talking to somebody or having like saying, or actually asking somebody in person, right? Like, if I saw somebody, on a Sunday morning, and then that afternoon they're like, and they didn't say anything to me all day, and then that afternoon they text me and I'm like, hey, are you free for coffee? I'd be like, why didn't you just ask me when I just saw you for like 3 hours, right? Like, I think that's a little bit odd. But that might be like, because I'm old and I'm a Gen X and not a millennial. I don't know, right?
Well, no. But that's the key thing though. Like there's always something invaluable every generation can impart. Thank you so much, Doctor. It's incredible knowledge. What we're hoping is that we're able to communicate this kind of information over to the general public. I do believe that there's a lot of young people, and our age too, that can benefit from this information out there. We hope that at some point we can come back to you if there are questions that come up down the line, and if there is an ability for us to kind of enhance with some of the subjects, we're hoping that we can reach out to you. But on behalf of AVP, thank you so much for your help with this.
My pleasure. Thank you.
Welcome.